Hello, 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 and welcome back to another episode of Mind, Your Body, and Soul. I am Joseph Ward, and Mr. Ian Costello is rocking with me today. Hey, Matthias, how you doing, Mr. Vacation Man? But shout out to Matthias and Miss Steeple. So remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. You can catch us on our website at www.nmcpodcast.com. And remember to visit our parent website at www.neighborhoodmedicalcenter.org. These NMCs mess me up. So also catch our podcast on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, right here on YouTube. Subscribe to the channel, like, comment, and share all these things. We got a good show today. We have a good show today because this gentleman is the CEO of Big Bend Cares, our lead agency here in the Big Bend area. He has been a part of leading an effort to get people into care in our area. Can't say enough about this gentleman. The creativity, the flair, the stick-to-itiveness, the toughness, everything he brings to the table. Our area is definitely better for it. The way his organization goes about bringing their services to our community, we're greatly just happy for that. Like everything Big Ben Cares brings to the table, and we really couldn't be doing the things that we do on the level without Big Ben Cares. So their leader, the CEO, Mr. Rob Renzi, welcome to the podcast.
Thank you. Can we just end after that? It's not getting better.
That's what he does. He brings you in like, okay, how am I supposed to live up to this? Like,
hey, man, so much more good stuff to go.
You're welcome to take us on the road. He can do this anywhere you go. He can bring you in, right?
There you go. There you go. Welcome, but thank you once again, and welcome to the podcast. Yes, sir. Yes, sir. So, Ian, you got the first question. Let's do this.
I'm gonna get it started. Can you just tell us who Rob Renzi is, and how did you become interested in working within healthcare industry?
Okay, so I grew up in Delaware, and my first job when I was going to college was with the state of Delaware in a mental health group home, and while I was taking psychology courses, and I worked there in various positions in the state for about 21 years. So that was healthcare since I graduated high school. I moved from there to the private sector, working for nonprofits who also did healthcare, but also HIV, and that was my first real exposure. My boss in my first job at that halfway house was an MSM, and we knew lots of friends that were passing away. This was early 80s.
Right.
So the very start of the epidemic. My office mate, I was sharing an office at the time with a lady whose son was a MSM and passed away of HIV. So it became part of my life right away. I have an older half brother who passed away as well. At that time of the early 80s, there were a lot of people passing away. So it really touched a lot of sectors of the society. I was recruited for a job in Asheville that was away from HIV into disabled children. And I just couldn't do it. It was too sad for me. Very severely disabled. So not just,
right.
remote. So that people that had to be cared for 24 hours a day, help with feeding. I mean, literally very disabled. And then I was recruited for this job in 2005 and have been here since. So that's me. That's how I got here.
So like, because you say right out of high school, you jumped into healthcare. So like as a high schooler or as a young man growing up, was working in healthcare like one of your dreams, or did you have other thoughts, but it kind of just led into healthcare?
So, to be honest, I was just my parents told me I could buy a car as soon as I had money to buy one.
Right.
And I was 16, and so that really entailed getting a job. And I applied for this job and got it. So, ta-da! Here I am. And to be honest, the schedule for going to college, I worked a night shift in a 3-person rotation. So it was me and two. So I'm 16, and my 2 nighttime coworkers were African American women, both in their late 50s, nothing in common, and best of friends. And so you worked 2 days, then you worked 2 days, then you worked 2 days, and you just rotated from 4 in the afternoon until 8 the next morning.
Wow.
So you did that for 2 days. When I first started, our patients were very institutionalized mental health patients who were used to going to bed at 7, 8 o'clock at night. Well, that seems like a great time to do my homework.
Right.
Yeah.
And then I go to classes, and then I got 4 days off and, do what 16-year-olds who are in college do.
Right. Now, that's cool. That is cool.
And
So
That's a very nice work schedule.
right.
So my first job paid $84,000 or $8,400 a year was my starting salary. $8,400.
Hey, you got to start somewhere.
16, that's not bad at all. Like,
As a full-time state employee, $8,400.
Yeah.
It was whatever that is. It's like $4 an hour.
the question is, did you ever get the car though?
Oh, I got the car right away.
Good. Put the work in. Okay, so
$4.03 an hour.
oh man.
Wow.
Raking in the big bucks.
Yeah. I remember I came up on the tail end of the $4 an hour thing. So I caught it like $4.53 an hour, and I thought, man, what is this? But yeah, okay. It was a come up.
A little bit.
Right. Okay, so you say you're recruited in 2005 by Big Ben Cares. So for those who don't know, it's a lot of people who have an idea what Big Ben Cares is. So could you give a history of Big Ben Cares as much as can? Who founded it? Why was it founded? And how did it grow into the entity that it is today?
So it was founded in '85 as an all volunteer. So same time I'm in Delaware, founded by Virginia Kirkland, I believe, Kirkland, Virginia for sure, as an all volunteer organization in '85, and then was incorporated in '87. And it really was direct response to the HIV crisis.
Okay.
And at that point, no money, no grants. Ryan White didn't start until 1991.
Right.
So no HIV prevention money, no HIV care money, just really grassroots donations, buddy system, companion services, and really the staff was really just taking care of people who didn't have anybody else,
Right.
as the clients were passing away. That really was the onus.
Right.
And then the Ryan White CARES Act passed in '91. And we were selected in this area, Tallahassee, and at that point it was 14 counties, to be the lead agency. And that started the whole Ryan White Care, and it's evolved over the last 30 years now to what it is now. In sometime in the early 90s, 92, 93, we Basic of Northwest Florida, Valerie Mincy, who's one of my best friends, over in Panama City. They and their agency split off from us. So what was Area 2 in Florida became 2A and 2B.
Right.
And Valerie and Basic sort of went on their own way with their 6 counties, and we kept 8 over here. And then it pretty much went along with that. New grants came in from the CDC for HIV prevention. HOPWA and housing, various funders, MAC Cosmetics and other Broadway Cares, and lots of foundations popped up. Bill Gates Foundation, the same stuff you guys know about, started popping up around HIV and managing the disease and looking for a cure, and because it is preventable. It's a completely preventable disease. So all that started, and then in 2000 and to be our 25th anniversary, so 87, 25, 2012, we started with the 340B pharmacy program, and as over the last 5 years, made the commitment as a board in their 25-year strategic plan to by year 30, which was 2017, to start and build our own clinic on the south side. Very similar to what you're doing from me right outside my window. To move away from just being social services, but also to bring wraparound services to all our patients, but also to bring, with the Affordable Care Act, a lot of our uninsured patients that were going to bond and neighborhood, because you guys handle the uninsured for almost all the Ryan White. Now they have insurance cards and they want to go see a private physician, and they want to go to, see a private medical provider. But when they get there, they realize all you really have is the insurance card. You don't have transportation. You don't have all the things that you and I and Bond all provide as those wraparound holistic services. Well, now all you got is this insurance card, and it doesn't get you all those other wraparound services. And if you're going to see a private provider or TMH, well, they don't have the labs there, and they don't have their pharmacy there, and so all the things, but they didn't necessarily want to go back and be uninsured. So what we sort of sent out as a model, and obviously Janae and Dr. McMillan from Bond and Dr. Mazziato from TMH were all part of this sort of collaborative, was that we understand you don't want to change your doctors, but you want all the other stuff that you used to get. So why don't we all just be in the same building so you can see Dr. Ford or TMH docs or whoever you want, but still get all those other things and see your case manager. So it was really a collaborative effort to bring everybody here, let them have free space in the building, see the patients, and then we'll do all that other wraparound stuff that they lost when they got in the Affordable Care Act. So that was sort of the onus, and it's really worked out really well. The partnerships have been great. I know, unfortunately, with HRSA's got some regulations that no two FQHCs in the same building. So if I know HRSA, the HIV section would love for you to be here, but HRSA FQHC says no. So the bureaucracy still unfortunately gets in the way, because I think that would be even better if we were all able to be together. I know we meet with you before COVID, we were meeting with you all, and we can discuss patients, and it really helps make seamless services for everybody.
Definitely, because so when people think about Big Ben Cares, they also think about CarePoint. So even though there are two entities, how do they work together to provide services to the community?
So CarePoint really is just the name of a building. It's not an entity. Big Ben Cares owns CarePoint and is the 501c3. So the easiest way to explain it is, if you work in the Empire State Building, you don't necessarily work for the Empire State Building. You may have a company who has offices in the Empire State Building. So people work here, they work for Big Ben Cares, or they work for Bond, or not neighborhood, but Dr. Ford's office, or TMH, or FSU, but they work in the building called CarePoint. So what we decided was we didn't want to build an HIV clinic. that we wanted to provide services to the whole community in a very integrated fashion. So, and you guys know the rules of FQHC.
Yeah.
So
Yeah,
you are forced to charge people on a sliding fee scale. And sometimes that gets in the way.
Yeah.
We are not an FQHC. So we can actually say free is free.
Okay.
So if you are an uninsured patient and you need medical services, we will provide those to you free of charge. The city of Tallahassee has given us some money as well in a CHSP grant that we can also help with. If you're uninsured, not only will we not charge you for our services, but we will pay for your medications, your labs. So truly care could be at no cost. I know the FQHCs would love to be able to do that. And
yes.
Again, sometimes the bureaucracy gets in the way of what's best for the patient. And I understand it, but it just gives another option to me.
Right. But my mindset though is I just want at the end of the day, I want the patient to get the care. So even if we have to send them to you, the patient gets the care, and that should be our mindset, is directing the patient wherever they want to go, but making sure we give them the information and the resources to help them help themselves.
What I have found is, say my sliding fee scale is $12. If the patient is sick, their kid is sick, family member, they're not feeling well, they are happy to pay the $12. Where we lose people is I'm taking my high blood pressure medicine like I'm supposed to, everything's going great, and it's time for my routine lab work. Well, I only got $12 and I could eat, or I could pay $12 for lab work when I feel good.
Right.
Yeah.
And then they choose to eat.
Right.
And then 3 months later, because you know what it's like trying to get people on the phone, you now haven't done your lab work, and Dr. Steeple says, well, I'm not going to refill your prescriptions till I see you again, but I still feel good, so I go without.
Right.
And now 4 months after that, I'm coming back to Neighborhood or Bond or Big Ben Care saying, now I'm not doing so well anymore. But the onus of that really goes back to that first $12 when you felt you didn't need to pay it.
Right.
Because you felt good. It's just, and men are horrible at that. Me in particular. I don't go to the doctor if I feel okay. What am I going for?
Right.
And then if resources are tight, that's just another reason that you justify that I shouldn't go because I feel good.
Right. Yeah, that's a dilemma. That's a dilemma for a lot of people. It's real life. So, and see, in that makes me think, from 2005 when you got here to now, I know you saw a massive change in Tallahassee in HIV, but what was the state of HIV in Tallahassee in 2005 compared to where it is now?
So I argue this with the state all the time. So the first question I asked on my first day was, how many patients do we have?
Mm-hmm.
It was 364. And Neighborhood Health wasn't doing any HIV at that point. You guys were not the Part C.
Right.
And Bond had 300 or 400, but a lot of those were overlapped. And I had in Ryan White funds not quite $900,000. That was my annual grant for 364 patients. So today we're about 1,100. And I still have $900-some thousand in Ryan White funds. So the patient amount has more than tripled, but the federal funding has not hardly changed at all. So stigma has gotten a little better,
right,
but not completely better.
Right.
Better.
Right.
Medicines are way better. I think people can live a long, healthy life if they're on their medicine and compliant. I think that's changed a lot since 2005. It used to be a whole handful of pills a couple times a day. Now it's just one, some of them just one pill once a day. So I think being healthy with HIV has changed a lot. And then some stuff just hasn't changed at all.
Yeah. So with Big Bend Care being one of the lead agencies in the Big Bend area for care like that, how do you, what does it mean to you to be the lead agency, and how do you provide those services to the community?
So lead agency really just means that we get the job of coordinating everybody else's stuff to make sure that the patients don't slip through the cracks. So right. It really just says, so can you as the lead agency work with Bond and Neighborhood and make sure that you got, between the three of you, you're trying to get everybody. That's really all it means. It does give us a lot more money in case management than it does for the Part C and the Part D. So that the Part B money is really social services money. So right. Case management and then dental services and other things that we can pay for clients, co-pays, etc. So there's more money in that area and then all the reporting. So I know you will hear from Rebecca regularly that she needs some data from you. Can you send us some lab work? And all of that they put that onus on us, that even so if we have a mutual patient and you're doing the medical care but we're doing the social service care, then they say, well, you got to get that information from Neighborhood or Bond right. or Dr. Ford's or wherever I got to get it from. So it's a huge reporting requirement up to the state, who then sends it to HRSA, whereas you guys do your reporting and it goes straight to HRSA.
Yeah.
So we have a middleman who likes to add some things before it gets to the end product.
Right. Yeah. That you got to deal with HRSA. You got to deal with HRSA. Yeah. So a lot of people really don't understand what the state of HIV was like. Let's say in Florida, especially like the mid-90s. A lot of people, they understand HIV is present in the community. It's present in other communities. They hear about it a lot. They hear in PrEP, all these different things. They have new technology. But from a realistic standpoint, like how big of an issue is HIV still in this 8-county area here? Are the HIV cases increasing? Are they decreasing? Are people's state of health getting better? How is it in your opinion?
So our cases only go one way, and that's up.
Right.
And mostly because you get new infections, but people aren't passing away anymore. So it used to be more of a balance when people would pass away and new cases sort of stayed level. But because of advances in treatment, people are living longer, healthier, but you still have new people coming in. The other thing that has happened recently is weather-related events and COVID.
Right.
So yeah. I know we had a pretty big influx from Valerie's area over in Area 2A in Panama City because of Michael.
Right.
And a lot of it because there simply wasn't any place to live. A lot of the low-income housing was damaged by the storm. They still haven't rebuilt it. A lot of businesses closed and went out of business. And so, restaurants and things like that along the water where people were working and they can't find work because the businesses are still shut down. The hospital shut down. So we had a fair influx because we were close. And it's cheaper to come this way than it is to go to Pensacola.
Yeah.
So we had a fair amount of influx from those people. And then now with COVID and the mortgage crisis, we get a lot of influx from South Florida just because the cost of living here is significantly cheaper than Miami or Pinellas counties, Broward County. So you get a lot of, and then Georgia, because you get some crossover from the state line as well there. So, we get a lot of transient cases that come in from other areas and other jurisdictions. And then, we are the university capital here. So
Just about to say, yeah.
you have a lot of clients who come in who are in school, whether it's FSU, FAMU, TCC, Kaiser, that are here just during college times that need care while they're here.
Right.
And that may or may not be, and I'm sure you see it, may or may not be out to their parents.
Right.
Don't want to use their parents' insurance, even though they could, because they don't want them, especially HIV, STD is, crazy bad. And they don't want to use their insurance because they don't want to tell mom and dad that, I've contracted, because of course you're not having sex while you're here.
What?
And then in Gadsden, you have the concentration of the jails, where they don't do a lot of testing in the jails, because if they test you when you come in, then I have to provide medications to you, and we all know how expensive that is. So they test them on the way out, and then does that test result get to us so that we can coordinate services in a timely manner? It is not, I would say, unnatural that if I've been locked up for 5 or 6 months and have contracted HIV, that, one of my first orders of business when I get home might be to reacquaint myself with my wife or girlfriend.
Right.
We sort of have to get ourselves intervened in between those two things. And that becomes difficult depending on the notice from the jails. I'm sure you all see that as well. Mm-hmm. Especially since you're in Gadsden County.
Yeah. I see it a lot.
Yeah. So with the spread of HIV like we talked about, and with it being like a university town with so much influx from the different areas, if somebody is newly positive to the area or just newly positive to the city, what services do Big Bend Cares provide for those newly positive patients to try to get them the treatment they need or the services? What can they provide to those newly positive patients that, I just became positive, I don't know nothing. If I come to you, what can you provide to me to help me get better and get treatment?
I'm sorry, could you say that again?
If I'm a newly positive patient and I come to Big Bend Cares, what services can you provide to me to help me to understand my new situation that I'm in?
So we're going to meet with you one-on-one and help you both let you know, because it's a federal program, so there is some paperwork, what you need, what we have to get, try to help you get it. We are going to offer you a peer, so somebody who's living with HIV, that if you need some supports or just want to talk to somebody who's living the same experiences and what to expect and how to work the system and provide that to you. We'll give you a list of all the providers based on what who takes your insurance, if you don't have insurance, what your choices are. We'll set you up with those appointments. We'll provide transportation to those appointments if that's what you need. Food bags, if you need assistance with housing. A lot of these sometimes can also entail maybe a domestic issue if I found out that I'm caught HIV or contracted it from a partner that didn't disclose. So we can get you set up in housing. Basically anything as far as a holistic need. If you need an appointment downstairs at the clinic, x-rays, labs, medications, we really try to do from A to Z and make sure that you've got everything you need. And then, the peers will do wellness checks, just checking on you to make sure, hey, we still need this. Did you need me to help you with that? To make sure that you get enrolled quickly and seamlessly, and then make sure you get that first doctor's appointment where we can get you started on medicine.
See, I really love the process that you guys have, as well as the case management and the peer advocacy. Like, I really, really love that, because like we all know, we see a lot of patients, or we may come across patients who they really don't know where to start. This is new to them. They may be afraid to talk to other people. This is it's just scary to them. And to be able to sit down with a peer who can understand what they're going through, but also can lead them to somebody else and say, okay, we're going to help you get to this point. That's powerful. Because it's like you guys have really helped me really look at case management just in life. I think case management needs to be delved out in different sectors of life, just to be able to help people get from A to B, because a lot of people really have no idea where to start. And then something like this, especially with the stigma the way it is, you guys really do a great job in getting people into care. So.
Thank you. And I think it's, this system, it works. It's expensive, but I think it is starting to be looked at for other chronic diseases. So diabetes and high blood pressure, case managers can help with all of those things.
Yeah.
In helping you choose the right foods. You know where we are on the South Side. Access to fresh produce. It's hard to eat healthy when you don't have access to fresh food. So, bringing that either into the community or having transportation services so that you can actually help people get to those things that help then their diabetes, their cholesterol, their high blood pressure. I agree with you. Case management could be used a whole lot more than just HIV.
Yes.
Even if it's finding, it could be helping people get from renting to home ownership. I think there's a lot of unused potential.
It is. So how do you, and I'm asking it, I know the answer, but I just want to explain. So how do you reach the community of people who don't come to you? Because most people know where you're located, whether they pass by you all day and recognize it or not, and especially with the CarePoint building. But just kind of tell people, what do you do to reach the community of people who may not come to Big Bend Cares?
So all case managers will do home visits. So they'll come out to you. And sometimes the home isn't a safe space either. So McDonald's will work. You're out in Liberty, you go to Piggly Wiggly. That's where everybody else goes. So you got to do what you got to do. It's meeting people where they are. The prevention, we have an office in Gadsden County, sort of very laid back, right next to the donut shop. So, if you want to meet in a donut shop, that's doable. Offices in Appalachia at Appalachia Center in Madison and Jefferson. So it's very much meet people where they are. Mm-hmm. If they need transportation, there's no public transportation out there.
Right.
And there's not a lot of providers out there. So it really is, you got to come here and then you got to go back home. And so we make those as, because of the stigma, we don't put 2 or 3 people on a van. It's a single person transportation. And obviously that's not the cheapest way to do it.
Right.
And the van drivers are also peers. And I find that to be a great time to have conversations. If I'm picking you up in Apalachicola, we got 2 hours.
Yeah.
2 hours here and 2 hours on the way home to talk about what you just heard from your physician.
Right.
Yeah. And so those become very poignant places where conversations can occur.
Right. Yeah, definitely. Definitely. Appreciate that. Oh, and in addition, your HIV outreach services under Cammie Edwards do a great job in working with them forever. Do a great job of getting in the community and educating people.
Yeah.
Yes, sir.
Go where you gotta go.
Right.
From the CEO point of view, what advice can you give patients to ensure that they get the most out of their healthcare visit? I know you're at the top, so what can you tell the patient that they get the most out of their visit?
So first thing is be honest.
Yes.
I am a horrible patient, but I'm honest. So if your doctor says, I want you to do A, B, and C, instead of just saying yes, 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 if you are not going to do A, B, and C, say that. I'll do C, but I don't want to do B. And talk to him or her about what are the alternatives to that, because there may very well be some, but you're not going to know if you just nod your head and then walk out the door and you don't do any of it because you never had any intention to, but you didn't want to tell them.
Right.
So honesty and communication is key. Be clear with what you want and what you need. You should expect to be treated well and with respect by your provider. But then once you agree to a treatment with your provider, stay on. If you've agreed, then you got to do it. And that's, I'm a big believer in that. I may fight you on the front end about what I'm willing to do, but on the back end, if I've said I'm going to do it, then I'll stick to my word. And I think both of those are keys to really maximizing the benefits of healthcare.
Right. Helping you help yourself.
Correct.
Right. And I think that's important for people to really understand. The system works best when you work it.
Yep.
And it's our job. We're your team. We're gonna be there, but you have to get the ball rolling. And because we literally legally can't do stuff if you don't do it. Yeah. So once you make the rule, we'll be right there with you. So Big Ben Cares, CarePoint. Of course, CarePoint's been around a few years. Big Ben Cares been around for a while. What's the future look like for both CarePoint and Big Ben Cares? How do you guys see yourself moving into the future and providing care for the Big Ben area?
So I think this design is probably what is going to be for the next 3 to 4 years. Mm-hmm. This is a very large building with a very large mortgage. So until that's paid off, we are what we are. I think then it's at that point, 3 or 4 years, we will probably look at see what's the next version of Big Ben Cares. Do we want, housing is a tremendous issue here. And, with our patients, a lot of them on fixed incomes and SSI, SSDI. So is starting to get into the low income housing something that the board wants to do? Is it expanding clinics in some of the remote areas like Chattahoochee or Greenville, where, maybe it's not a full-time, but it's part-time? Mm-hmm. You guys can't be in the building with us here, but if we have a different building, maybe that's a partnership we have.
Right.
I think the board hasn't really. We just finished a strategic plan. I think some sort of mobile unit is probably the next acquisition. I know Cammy's department would really like a place where they could do some mobile testing. So probably pretty high up on the priority list is getting them that. Especially because Basic just got one, so the pressure's really on.
Yeah.
You guys are great and partnering with you all on your van sometimes. And then Bethel AME and Reverend Holmes just got their van. So we got a partnership with them to try to help them out. And they got the van, but no medical staff. So I'm sure you're a part of that as well. Trying to get into, I think we do a good job, all of us, providing services to the people that will come to us. Mm-hmm. But there are just people that won't come. And so it's more and more about taking the service to a neighborhood or to a housing complex, or those are the things that are probably the next step.
Right. I love it. If you don't evolve, it's gonna be like Blockbuster. So yeah, you have to evolve. People listening, he just told you about their strategic plan moving into the future, which means that not only are they taking care of today, but they're planning for tomorrow to make sure that even people in the future have the care that they need. And hats off to you, your whole staff. You guys do a great job of providing services in this area. You guys do a great job of just bringing everything to the table. Artopia, I love Artopia. For those who don't know, it's a art auction event where you get the community together. It's a fundraiser for Big Ben Cares, and they get a lot of artists, like people who you didn't even know were painters and things, are donating paint, and it's a fundraiser for Big Ben Cares. But it just brings the community together. Great food, great conversation, get to meet people and network and see who all have their hand in the fight to help us get better. So, go ahead. I'm sorry.
Oh, it's great. It's just fun. And so people who would not necessarily be involved with something like the AIDS walk that we all partner on will come out to Artopia just because, well, that's just the art auction. So, and that's fine. But as long as you're buying art and the money's still going to help HIV people, if all you want to do is just get some art, I'm okay with that too. Right.
And speaking of AIDS walk, September 16th in Tallahassee in the Art Park District. So we're making it happen. Y'all make sure you all be there because we will be knocking on your door to make sure you be there. So.
And that's turned into a great partnership where we all sort of work together on a fundraiser and then split the money equally. I think that's much more community based than just a Big Ben Cares fundraiser.
Right.
And it's easier if we split the work by 3 because a fundraiser is a lot of work.
Yes, it definitely is.
So before we wrap this up, can you tell people how they can contact Big Ben Cares, learn more about Big Ben Cares, they will contact you if need be?
Sure. You can go to the website, bigbencares.org, or CarePoint Health and Wellness. For CarePoint, if you're looking for medical services, our phone number is 850. You got to dial that now, people. 850-656-2437. You can do that from the website. You can go on our Facebook page and get there. Make an appointment, ask about information. I'm extension 240 if people want to contact me directly, ask questions, or if there's some interest in partnerships, happy to do that. And I would be remiss if I did not say what a joy it is to work with Janae, your CEO. She is a fabulous partner, and congratulations on your efforts to get that giant grant. So congratulations to people listening. Janae spearheaded an effort for all of us to all partner together for $1 million grant that's coming to this community, and it would not have been possible without her. And congratulations for getting into Leadership Tallahassee's class 39.
Yes. We definitely excited for her about that. It was like, you have to do that.
Yes.
But the collaboration, the partnership, it's all appreciated. I've been doing this for 12 years, and it's been a joy. It's been a pleasure. I wake up wanting to do this. I haven't dreaded going to work in a while. And it's not just here, but it's in the community and people like yourself. So I want to thank you once again and just celebrate you. We're celebrating you in this podcast. You and Big Ben Cares.
Well, you and Mateus cornered me in that meeting, so
Yeah.
They have a way of doing that.
I did observe that. Yes, indeed. Well done.
Hey, we've been practicing.
Well, I thank you for the opportunity. You guys have a great day. I appreciate it.
Yes, sir.
Great
Thank you.
seeing you.
Talk to you soon.
Take care.
Yes, sir. Yes. So, Mr. Rob Renzi, Big Ben Cares, man. Look at him. That was a good one.
Another great one for the books, man. Another great one.
I knew because of his personality, I was like, he's gonna bring it. And I wanna thank you for riding with me today. We know Mateus had to go. He had to take a break. So we ain't mad at Mateus. We glad that Mateus took a break because Mateus don't know how to take a break, so he took a break.
Because when he come back, he's gonna be recharged and ready to get it. And then I can go fade back to the background where I love to be.
Hey man, but like seriously, look out September 16th, AIDS Walk at the Art Park here in Tallahassee. We will be there, the I&J Express DJ Ian on the ones and twos, and I'm on the mic doing my MC thing. So make sure y'all come check it out. More information about the AIDS Walk is on Big Ben Cares website, bigbencares.org. So make sure you check that out. And you can check out our social media. Follow us on Instagram. Neighborhood Medical Center on Instagram. Neighborhood Medical Center on Facebook. Subscribe to this video. And that's how we do it. I'm Joseph Ward. He's Ian Costello, the main. And remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to becoming the healthiest versions of themselves. www.nmcpodcast.com, www.neighborhoodmedicalcenter.org. Remember, we're on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, YouTube. Subscribe.
Follow.
We are out of here.